Welcome, everybody. This is Professor Jay Bhattacharya, and this is the Illusion of Consensus podcast. I'm here with my good friend, Dr. Kulvinder Kaur. Thank you, Kulvinder, for joining me for this podcast.
Thank you so much for having me, Jay.
So I am absolutely delighted to have you because I've been watching you advocate for years now for sane policy in Canada, a place where it's just been heartbreaking to watch how schools closed, the lockdowns happens, businesses closed, the focus of so much of Canadian medical attention was on COVID prevention, and you were advocating that health should be taken more broadly. And I invited you on the show because I know that as a result of the advocacy that you had, you have faced tremendous backlash from Canadian medical authorities, from the Canadian press, and I am delighted that you agreed to tell that story here today.
Thank you, Jay.
Okay, so I want to start by telling the audience a little bit about your background as a doctor, as a scientist. How long have you been in practice? What's your practice like? What are your patients like? And what's your academic and research background?
So I've been a practicing frontline physician for over a decade now. I'm a specialist physician here in Ontario, practicing in the Greater Toronto area. I have significant postgraduate training in both pediatrics and allergy or clinical immunology, and my practice predominantly right now is with both pediatric and adult patients at allergy or clinical immunology clinics. And I practice in communities that are predominantly marginalized populations. So in both of the communities that I practice, a large portion of the population is actually working class, poor immigrants. In one of the communities that I practice in Brampton, it's actually known as one of the most ethnically diverse in the country, where 73% of the individuals actually identify as in people of color, mostly being South Asian and in Black. So when COVID hit and the harms of the lockdowns were coming forward, it was impacting the people that are within the communities that I practice. It was impacting my patients. And I bring, I was also viewing COVID through the lens of a scientist, because prior to practicing as a physician, I had done significant microbiology, of virology, of vaccinology, or research at various university and federal government laboratories, including the Public Health Agency of Canada's National Microbiology Lab. And there my focus of research was actually on HIV-1 vaccine development based on a T-cell or natural immunity that was found amongst Kenyan sex workers. And in my practice on a day-to-day basis, I routinely actually administer childhood vaccines, and I've been a strong advocate of that. So when, instead of engaging with my points of concern and my advocacy and the research that I was bringing forward in the summer of 2020, when I first started to speak out against lockdowns, when I was being targeted and smeared as being an anti-vaxxer, I found that absolutely shocking.
I mean, that we're going to get into that story, but it is absolutely shocking. You are a immunologist, you are a doctor, you see pediatric patients, you give routine vaccinations to pediatric patients all the time, and somehow, because of your advocacy against lockdowns, because of your sharing peer-reviewed information about immunity about COVID, you are attacked as an anti-vaxxer by the Canadian press and and indeed that's by the Canadian medical authorities, entirely a non sequitur. Okay, and during your decade plus long practice, you've been, I mean, you've been a fantastic, upstanding doctor. You've never had any issues. The reason I ask is because we're going to talk about some of the persecution that you faced during the pandemic. And I just want to set the record about this. You were a doctor in good standing. You were a leader of the community. You led a group called Concerned Ontario Doctors. So I mean, you were seen as a leader among doctors in your community.
Yes, I've actually, even to date, have never had a patient complaint to my professional regulator. So all of this just suddenly happened when I started to speak out against all the lockdowns on social media back in 2020.
It was interesting because, like, I was a lurker on Twitter back then. I didn't have a Twitter account, and I immediately noticed your advocacy against lockdowns, but it wasn't. But also, I don't know if the word advocacy is the right word. You were instructing the public and others about the science of immunity. Like you would have consistent posts about how lockdowns were harming the communities you serve. The lockdowns were harming the broader poor, the broader community, the poor all around the world. That was a consistent theme in your posting. But also, you would post information about what the scientific data were showing regarding immunity after you recover from COVID. Immunity even before you recover from COVID, if you'd had exposure to other coronaviruses, providing cross protection.
Mm-hmm.
What led you to the point where you were taking to Twitter to make the case against lockdowns, the case in favor of immunity?
Prior to practicing medicine, I had actually done significant scientific research at various federal government or university labs, including the high level 4 biosecurity lab in Canada known as the National Microbiology Lab. And there, my supervisor was actually the chief scientific director of the NML and the chief scientific advisor to the Government of Canada, Dr. Plummer. And my research had specifically focused on harnessing the powers of natural T-cell immunity that were found amongst Kenyan sex workers and trying to develop an HIV-1 candidate vaccine based upon that. So in the summer of 2020, I became extremely intrigued by the amount of peer-reviewed literature that was published speaking about both the pre-existing or cross-reactive T-cell immunity and the strong post-infectious T-cell immunity that was being observed. And this was completely being ignored, not only by the media, but a large segment of my colleagues as well.
But there was more than that in your advocacy, Kulvinder, I have to say, because like one of the things that struck me as I was reading your posts in those very stressful days in summer of 2020 was a concern for the global poor. Like I saw in your posts, especially in your criticism of lockdowns, a clear-minded approach to what the lockdowns would mean for the global poor. This was something that was lacking in so many of my my colleagues who were advocating for lockdowns. It's as if they had blinded themselves to what the economic dislocation caused by lockdowns would have on the global poor.
Right.
How did you come to that?
My path to medicine wasn't a traditional path. So I was initially born in a very small farming village in rural India. And when I was a baby, I had immigrated with my family to a very small town in a remote northern Manitoba. And when I was a young, just in elementary school, my mom unfortunately was diagnosed with breast cancer. And so as a young teen, I would often accompany her on the nearly 600-kilometer round trip down to Winnipeg just to access essential cancer care. And it was then that I decided that I wanted to be a doctor. And my mom was extremely encouraging of that. And she unfortunately passed when I was in medical school of a metastatic breast cancer, but she had been fortunate to receive palliative care during her last few months. And when the lockdowns hit, what I found extremely heart-wrenching was the patients that were at the end of life, palliative care patients, terminally ill patients that were being forced to die alone in our hospitals and medical institutions without their loved ones at their bedside. I was alarmed by the numbers that were being projected, by the amount of people that were projected to go into poverty and death in the developing world because of our developed world's lockdowns, because of supply chain shortages. And there were numbers coming out of excess of 10,000 pediatric deaths a month just in the developing world because of lockdowns. And this was all alarming to me. And there were cancer surveillance programs were shut down here in Ontario. And the most important part of a cancer diagnosis is to be able to diagnose early so that you can intervene. And so as much of the medical profession became singularly focused on the virus, I started to become alarmed by the COVID response. And I started to read more and more in the peer-reviewed literature about how the infection fatality rate was actually extremely exaggerated, and the strong age stratified risk of where the elderly were at more than 1,000 times greater risk compared to the young. I was starting to read about the devastating catastrophic harms of the actual lockdowns. And so all of this compelled me to speak out in the summer of 2020 and speak out about everything that was being ignored, both in the media's coverage and sort of in the daily conversations that Canadians were having. And I didn't anticipate the response that I received.
Yeah, so what was that response? I mean, I think early on you had been advocating for your patients in Brampton through this Concerned Ontario Doctors for more resources. But then when you went to Twitter and started arguing against the lockdowns, how did the response to your advocacy changed as the tone of your advocacy changed, the content of your advocacy changed?
It was so alarming. So at the end of January, so just weeks before the WHO had actually declared the pandemic, I had led and organized a 3-hour delegation to the Brampton City Council, which led in a motion being passed, actually declaring a healthcare emergency and calling upon all levels of government for immediate frontline funding, because it is the epicenter of hallway medicine, and patients were dying in hallways because of lack of resources. And at that time, I was considered to be a leader in my profession, and that was positive media coverage. Suddenly, when I went against the narrative, I was seen as a black sheep and someone who should be shunned and not spoken to. And rather than engaging in any sort of debate or having any conversation about what I was trying to convey, instead I was being attacked with just labels, and the media didn't seem interested in actually hearing why I was concerned.
So can I ask about that? Because I found you on Twitter. Your advocacy reached me. So there must have been some positive responses too, in addition to the negative ones. But the negative ones, of course, there was always on Twitter. There's people who don't like what you say. That's just the nature of Twitter. But it went beyond just that, didn't it?
Yes. In the first week of August, I became the target of a very malicious
2020.
Campaign where people on Twitter were encouraging the public to launch complaints to my professional regulator. And that led to multiple.
Can I just, as a clarification question, how does that work? So you're a physician in Ontario. There's a body called the CPSO, which is the Canadian
Physician Surgeons of Ontario.
And so then when you say your professional regulator, they can take your license away. They can put sort of black marks on your records that everyone sees. They can make your life miserable. They can ruin your career.
Right. They have the power to actually take your license away. And so having never dealt with the CPSO before, I suddenly found myself the subject of multiple complaints just through this online campaign that these individuals had actually launched strictly because of my tweets.
So what do they? So they see you tweet against the lockdown. They see your tweet linking to peer-reviewed information about immunity, and they get so upset that they go to your professional regulator and say, look, you have to take our license away.
Yes, they were labeling me as dangerous to society for advocating the positions that I was advocating.
Now, were these just regular people that were going after you? I mean, if it's just some random person on Twitter complaining, I mean, I'd imagine the professional regulator would just ignore it. Or were there more powerful entities that were trying to get your to go after you because you were advocating against lockdowns?
It was more powerful entities that were well established within the Canadian media, some within the medical communities, or some within the scientific communities. But it wasn't these individuals that were actually launching the complaints. They were having the public launch the complaints. And then because there were so many complaints launched, and I then became the subject of a high level CPSO investigation simply because of my tweets, and that ultimately led to the CPSO throwing out and actually dismissing all the complaints that had to do with T-cell immunity or HCQ. However, they did in February of 2021, based on my August 2020 tweets opposing lockdowns, issue simultaneous cautions on the exact same tweets of me opposing lockdowns. So those are now going to be the subject of a appeal or this upcoming spring. So
the CPSO, instigated by these powerful entities, some of them we might mention in a few minutes when we get to the later in the story. The CPSO launched this investigation saying, "Look, you're sharing factually incorrect information about immunity and various other things." Finally, they dropped that. That sounds like that after like putting you through absolute hell. But then they still have investigation going over your advocacy against lockdowns from August of 2020. Now, I wrote the Great Barrington Declaration with Sunetta Gupta and Martin Kulvinder in 2020, October of 2020. Mm-hmm. I can tell you with certainty that there was a tremendous number of scientists who opposed the lockdowns as harmful, especially to the well-being, the health and well-being of the poor of the world.
Yes, absolutely.
And so, what you and I remember your advocacy. I remember you signed the Great Barrington Declaration, and you, I mean, you were a fierce advocate for it online. Again, at a time when I wasn't on Twitter, and CPSO is using that advocacy, well supported in the scientific literature, to still consider whether you should be licensed to practice medicine in Canada.
Yeah, so the cautions are still there. I haven't appeared for the cautions yet because it's subject to appeal. Ironically, I became the subject of another high-level CPSO investigation in 2021, which continued until 2023 because I kept tweeting opposing lockdowns and then mandates, which CPSO had then referred to a disciplinary tribunal. But miraculously, everything was withdrawn by the CPSO in September of 2023. So that suddenly disappeared. But over the COVID era, having never been the subject, even to date, of any patient complaint during the COVID era, simply because of my tweets opposing government's COVID policies, I had over 24 CPSO investigators assigned to me.
Now, what reasoning did they have for cautioning you? Like, what did they provide? Any reasoning why they thought that any advocacy against lockdowns were a danger to the public?
It seems to be going against the government narrative, right? So the government narrative is that lockdowns work, and so physicians are deemed to be spreading "quote unquote" misinformation if we're going against the government narrative of the actual lockdowns.
But the CPSO is a professional organization. It's supposed to be looking at scientific evidence. What did they cite? Scientific evidence? What evidence did they cite other than saying that the government says it, that doesn't automatically make it true?
I was in the decision. It had stated we know lockdowns can and do work because of China and South Korea.
So the Chinese example was the CPSO cited the Chinese example of zero COVID in January 2020 as the reason why they think lockdowns worked in August 2020, October 2020, and into 2021, 2022, and 2023.
Yes.
Remarkable. Okay, and it strikes me this is maybe this is normal in Canada, but I don't think so. I mean, I do remember seeing Jordan Peterson facing similar kinds of. It looks to me like a persecution. Like it's if you're saying politically inconvenient things, and it sounds like they explicitly said that you're saying things that are politically inconvenient against the government narrative. That's enough to launch an investigation. That seems to me like an abuse of power by the CPSO, by this professional licensing organization. They should be considering whether you're a good doctor, not whether you're advocating for or against government policy.
Mm-hmm. Especially when science is supposed to be the pursuit of truth, right? So the scientific method demands that physicians and scientists challenge the dogma, demands that physicians challenge whatever's perceived to be the prevailing view. And that's how advancements in our profession happen, right? Someone challenges the existing prevailing view or what's perceived to be the prevailing view, which then leads to more hypotheses, experimentation, conclusions that then are only subject to even more criticism, evaluation, more hypotheses. So it's an ongoing cycle. So if we have dogma that can't be challenged, well, that's not science, right? And then we end up being in a time where we won't have advancements of science, right? And my faith as a Sikh teaches me to seek truth, right? So Sikh means seeker of truth, and our scripture teaches us that the realization of truth is above all else, but higher still is truthful living, right? So the pursuit of truth is what my faith teaches me, but yet I'm being punished for pursuing that truth
because it's inconvenient to the government narrative. Okay, so now we have to unfortunately get to the sad, probably the saddest part of the story. So to set this up, you have all these people, very, very powerful people, going after your license. There are also hit pieces done on you in the Canadian press, making you essentially out to be enemy number one because you oppose the lockdowns. And they're not just saying that you oppose the lockdowns and you're wrong. What they're saying is that you're a bad doctor, that you oppose vaccination, that you in fact are an anti-vaxxer, which in medicine that's the death knell of your reputation, right? And it's some of the stuff is published in mainstream Canadian press,
right?
By opinion columnists who don't have any scientific background or medical background. And so how did you decide to respond to this slander?
So in an effort to clear my name, I had launched defamation action against the individuals that had been responsible for that malicious campaign in the summer of 2020. And what ended up happening was quite alarming. And before any evidence was even heard, before it even went to any sort of trial, something called an anti-SLAPP motion was actually brought forward. And what an anti-SLAPP motion is supposed to be for is to prevent powerful entities from actually silencing the small guy. And here it was actually used in the opposite manner, where there were defendants that were well-funded with insurance, with their institutions, had big teams of lawyers, and so this was brought forward. And in October of 2022, a judge here in Ontario ruled a $1.2 million cost order against me, which is unprecedented, claiming that I was a powerful entity trying to silence these individuals. And
let me just, I mean, that is just an absolutely shocking story. So I just want to make sure I understand it. You bring a lawsuit trying to clear your name because a whole bunch of people were accusing you of being an anti-vaxxer, a danger to the Canadian public and others, with no evidence behind it, except for the fact that you were tweeting against lockdowns, tweeting scientific studies, peer-reviewed scientific studies. The court, even before it can hear your case, has to consider a motion by the other side, which includes very powerful entities, including powerful entities in the Canadian press,
Mm-hmm.
that they make a claim saying that you, because you're suing them for defaming you, that you're silencing them.
Mm-hmm.
That the very act of suing them silences them. As best I can tell, none of those entities have really stayed quiet. So I don't. If you were silencing them, it didn't work, Kulvinder, I have to say. The but the court agrees with them. Agrees
Right.
with them that you, a doctor, not a political actor, not a media entity, a doctor posting your scientific opinion online is somehow somehow you have silenced them by calling them out for falsely accusing you of being an anti-vaxxer and so on.
So something alarming happened, and the court actually never looked at any of the evidence that was before it, any of the evidence that I had submitted, because it essentially took what is known as a judicial notice, where that's often taken where something is so well known and like established, as I'll say, example, the sky is blue. That the court doesn't need evidence for it. So the government's COVID response was taken as being the sky is blue. And so these unprecedented actions by the government, which have been extremely harmful and or detrimental to the most marginalized within our society, were taken as being the sky is blue. That these are so well known and apparently well supported by evidence that that doesn't need to be presented. And so the court never actually looked at any of the evidence that I presented and just took a judicial notice, essentially. And then everything ended there. Now,
The judicial notice, I mean, so for instance, the fact that Canada has worse all-cause excess death outcomes than Sweden, for instance, which didn't lock down. That fact you're not allowed to tell the court, or the court, you could tell the court, but the court will just ignore it, or the court did just ignore it. They just said, they took the government at their word and said, well, the lockdowns were the right scientific thing to do, even though,
right.
There's it's tremendous scientific controversy over them.
And in 2020, we already knew that about the harms surrounding all the school closures, right? And already the Sweden Public Health Agency had already published studies showing that despite their schools being open, there was no increase in all-cause mortality amongst children, nor was there any increase of transmission amongst teachers compared to any other profession. This was known in 2020. But that didn't seem to matter. The fact that Canada's COVID response went against Canada's existing pandemic response plans and the WHO's own pre-existing pandemic plans didn't seem to matter. So all of these facts and the harms of lockdowns just didn't seem to matter.
Okay, so they rule using this anti-SLAPP statute that you're essentially filed a frivolous case without actually looking at your evidence. And then they order you to pay $1.2 million to cover the costs of defending against this defamation case. Is that where things stand?
So I had then appealed both the cost decision and the actual decision on the merits. And that appeal was heard by the appeals court here in Ontario in December of 2023. And there was a ruling that came out at the end of February of 2024. And the initial $1.2 million cost order was appealed, but to appeal cost order, you need something called leave, which is seeking permission of the court. So it's not an automatic. And the court denied me that leave because by the time of the hearing, we had reached confidential settlements with some of the defendants. And so the court said that the landscape had changed. So they denied me the leave to actually appeal the cost decision. However, the appeal on the merits continued, and in their decision at the end of February, we had appealed on three main grounds, and they refused to take a position on whether they thought that I was defamed or not. So the basic premise of the test, they actually deferred, so they did not make any sort of a ruling on that. What I found shocking is that there is something known as fair comment defense, which allows a defendant to use that as a defense against a defamation if what they're saying is actually factual. And the court the appeals court did not actually engage with any of the evidence that was presented to it, and instead claimed that the defendants were using quote unquote approved facts.
Approved facts.
So not truthful facts or evidence-based facts, but
what the government says is true by definition because those are the approved facts.
Mm-hmm.
Okay, so and so is that how much do you after all those settlements and all this process? How much? Where do you stand now?
I've now been ordered to pay nearly $300,000 in the costs order, and I have mere weeks to pay. So my deadline is at the end of March, and it's $300,000 that I don't have after nearly 4 years of being entangled in multiple legal battles, trying to advocate for my patients, trying to advocate for Canadians, and to try to advocate for myself. And so it's now looking quite grim.
So what happens then? I mean, if you can't pay the order, you probably have to declare bankruptcy, I would think. What will that do to your ability to practice medicine? What will that do to your ability to care for your patients?
It's all very daunting right now, and I never thought that this would be the cost of speaking truth to power, of being compelled to speak my conscience, being compelled to speak against the harms that I knew were going to happen against the people within the very communities that I practice within the developing world, where I initially was born and still have very deep roots too. And everything that I warned about in 2020, which was at that time, which I cited, was based on peer-reviewed evidence, has now come to pass. And it's been absolutely heart-wrenching and devastating watching the carnage unfold, and being helpless, right? Because it was all completely preventable, and it was known in 2020, right? But so now the harms are actually being realized, and they're being tallied, and slowly they're now being acknowledged. But it seems like advocating for the truth and advocating for that scientific evidence to come forward has come at a huge cost.
So this Give, Send, Go campaign that you're starting, it's to offset the costs of the legal bills you face, essentially these punitive legal bills because of your advocacy against the lockdowns.
Yeah. So there is a Give, Send, Go public campaign that's been started to help to fund my legal fund to help to offset these costs.
Well, I'll be donating because I think I view you as a hero. I mean, what you've done has been come at tremendous personal costs. I know from our conversations during the pandemic, but you have made an enormous difference in the lives of so many people by advocating for sane policy, for advocating for policy that takes account of the well-being of the poorest members of society, and I'm grateful to you for that. So,
thank you so much, Jay. I'm also extremely appreciative of your voice, not only amongst the international community, but also here in Canada. And I remember way back in early 2021, when through Concerned Ontario Doctors, I had hosted yourself, Dr. Bhattacharya, Dr. Gupta from Oxford and Harvard at the time, with Dr. Shabas, the former Chief Medical Officer of Health for our province, just to talk about the Great Barrington Declaration. And that was Canadian first exposure or to having that scientific evidence of being brought to the forefront.
I mean, it has been heartbreaking to watch so many of my colleagues in Canada face the kind of persecution you faced. And so many people with credentials, people like Dr. Shabas, but a whole host of doctors who opposed the lockdown, essentially be silenced and intimidated. People were watching you and seeing what was happening to you, and many stayed silent because they were they didn't want to face what you faced, but you stood up anyways. And I have to say, I'm quite proud of what you've accomplished, and I hope that this Give, Send, Go campaign can offset the costs that the court has imposed on you, I think quite unjustly.
Thank you so much, Jay.
Well, this has been the Illusion of Consensus podcast with Dr. Kulvinder Kaur, and I'm Professor Jay Bhattacharya. Until next time, thank you for listening.